Hey everyone, it's Dr. Dave. Hope you're all having a healthy day. I have a great story to share with you today. One of the biggest questions we get here at the clinic from patients is they want to know how decompression works. What is this non-surgical spinal decompression? And am I a candidate? And if you understand the story behind what decompression is designed to do, you can get a better idea if you're a candidate or not, and how we decide whether or not someone's a candidate. And in fact, how much and what it's going to take to get somebody better with non-surgical spinal decompression. All depends on knowing and understanding a little story. So I'm going to share that with you briefly today. If you take a look at this model, this is a healthy spine. The bones are nice and smooth. There's nice smooth corners, square like a block, and in between there's this cushion called a disc. And the disc is nice and thick, same height all the way around. And that disc does a number of important things in our spine. It acts like a shock absorber. It provides enough room in between the bones so that a nerve can travel from the spinal cord that's housed inside those bones. And as long as this system is sitting and moving properly and it's healthy, it does something very neat. After the age of 20, these discs don't have a direct blood supply. They're fully dependent on the fluids they're bathed in to keep themselves healthy. And they do it through movement and motion. And that's why we say that motion is life and life is motion. So every day when you wake up, these discs get compressed throughout the day with gravity while you're sitting and standing. And then at night when you go to bed, those discs relax or the gravity comes off and they pull fluids and nutrients in and they heal themselves from everything that happened during the day. And as long as your spine is sitting and moving properly, it's going to do that once a day, every day, going to last a lifetime, and it's an amazing thing. If your spine, for whatever reason in life, from physical, chemical, or emotional misuse or lack of maintenance, isn't sitting and moving properly, that process is impaired. You're no longer squeezing out the same amount of waste. You're no longer pulling in the same amount of nutrients, and it starts to degenerate that disc. So what happens is the disc gets thinner, especially in the back, more so than the front, especially in the lower back, where we're most likely to get a disc herniation or disc damage. And what happens is that compromises the amount of room that that nerve has. And that can cause a lot of different health problems and pain and different symptoms. The disc starts to dry up, it dehydrates, or it's what we call it desiccates. And this whole thing kind of gets rusty. And when it gets rusty, but we still try to use it every day, that creates some conflict. It's under stress, and that starts to wear out the ends of the bone that are coming close to that disc. So now we have not only degeneration in the disc, but the bone starts to degenerate. And this is a progressive problem. It's relentless. It gets worse day after day after day. And when this disc dries up enough, the fluid from the middle, the gel-like stuff in the middle, starts to leak out, and we get our bulges, protrusions, herniations. People with sciatica and chronic or acute back pain know about these kinds of problems. But it goes beyond just the pain. There's a whole other functional issue here. But this is what the non-surgical spinal decompression does. Instead of just lying down at night, the decompression allows us to get in there with a gentle and controlled amount of pull, and we open that space back up again. And that creates a negative pressure or a vacuum in that space. And it forces that disc to suck in the fluids and nutrients it needs to start rehydrating itself. So unlike traditional traction, which was used to open these segments up just to take the pressure off, but as soon as you got back up, it was loaded again, decompression is done in a repetitive manner, where in a treatment, we may do this 10 to 15 times or more, pumping that disc, and it's restoring the physiology, the properties of the disc, and what it's supposed to be doing day in and day out. And when you do that, you're not only getting relief on the structures, but you're actually teaching these tissues to go back to doing what they were designed and programmed to do, and that can get them healthy. So through that process, by repairing this part as much as possible, you can get it sitting and moving better, and now you're going backwards through the steps that's caused this problem, and everything's getting healthier and feeling better. Then, as long as you keep it sitting and moving better, it goes back to that natural daily compression and relaxation, and it's going to take care of itself as long as you help it. And that's what we call maintenance. And that's why healthcare is more than just a treatment for pain. It's about identifying the cause or the source and getting back to a form of maintenance. Getting this thing repaired as much as possible, functional as much as possible. You feel great, and you're going to be healthier again. So knowing that, anyone who has degeneration or changes in the quality, the health of those discs is a good candidate for non-surgical spinal decompression. And the best way to find out, of course, is to get a consultation, get an exam, maybe get some imaging if you haven't already had some. But listen, if you're a good candidate, you qualify and you follow the steps, you can get some amazing results. We'd love to see you here in the clinic. Give us a call, give Katrina a call, book your consultation. It's always a courtesy. There's never an obligation, but you're going to love the results if you qualify. Love to see you here in the clinic. Hope you all have a great day. Speak to you again next time.